Today I'm sharing 3 fail-proof tests so you know exactly when to go to the hospital in labor. Many people know of the 411 or 511 rule when to go to the hospital, but not very many people know these tests, which I'm about to explain. With my first birth, I followed the 511 rule, but I still ended up calling my midwife way too early because I didn't know these tests. I was following the 511 rule, so I was having contractions every 5 minutes apart, lasting 1 minute long for at least an hour. Some providers will say 411, or even for some first-time moms, some providers will say 311. It was 3 in the morning and I was absolutely certain that I had to be at least 7 centimeters. When the midwife checked me, I was only 3 centimeters. She said to rest and come to the hospital in the morning at 8 a.m., which was still 5 hours away. I also want to mention this is general information only for low-risk pregnancies where you live close to the hospital. Check with your doctor or midwife for individual guidelines. Moms often focus on how far apart the contractions are, so we're wanting to have them every 4 or 5 minutes, and our bodies are amazing. There is an internal clock, and when your contractions are regular, they're going to happen regular to the second. If you have a contraction that's 5 minutes apart and then the next one is just a little bit longer, that doesn't count towards that hour of regular contractions. Your contractions should be very regular, as well as getting more intense and closer together. Just as importantly as how far they are apart are how long the contraction is lasting for. So you need a good 60 seconds of contractions to have that cervical change where it's dilating and starting to efface or getting thinner. The first test, which can give you a really good clue on whether it's time to go to the hospital, is the talk test. At the point where you are having significant cervical change and need to go to the hospital, you will not be able to continue talking or continuing on with your activities during your contraction. Your contraction will be intense enough that you will have no choice but to just stop, focus, and breathe. The second test you can use is if you are using the 511 or 411 rule, but maybe it's a little bit irregular or maybe your contractions aren't quite lasting 60 seconds, you can take a warm bath, not a hot bath, and really focus on relaxing. So this test, called the bath test, when you are relaxing, your contractions may dissipate and you may not time to go to the hospital. However, it can also be really effective, and this can kick things into gear, and they maybe get more intense and more frequent, and it may be time to go to the hospital. I used this in my second birth when I wasn't quite sure. I started timing my contractions. I got in the bath, I relaxed, nothing really happened. I got out of the bath and boom, all of a sudden my contractions were very intense. They were very regular, and it was definitely time to go to the hospital right away. The third test is the pain scale test. Regardless of what your cervix is doing, if you are in a lot of pain, you can always go to the hospital to get support. 0 would be no pain, and 10 is you're getting surgery without any anesthetic. If you feel like your pain is in that top range, definitely call your doctor or head into the hospital. Of course, you also want to call your provider and head into the hospital if your membranes rupture or your water breaks, if you're experiencing any vaginal bleeding that is more than just spotting, if you are in continuous pain that doesn't go away between contractions, if you're concerned that your baby is moving less, or you're concerned for any other reason. It's always better to be safe than sorry. If you have to head all the way into the hospital and they check you and turn you around again, that's okay. No one is judging you. And this is something that the staff at the hospital see all the time. A few additional tips are to prepare to birth at home for a long time, especially if it's your first pregnancy. Birth can be long and you may birth at home for up to 24 hours. Also, if you're in early labor, rest as much as you can and try to sleep if possible. Also, drink lots of water. Dehydration can cause false labor. I'm also going to link to a video that I get a ton of positive feedback on, and that's 15 steps to your easy delivery. Of course, I will keep putting out pregnancy workouts, HIIT, yoga, Pilates every week. If you like videos like these, subscribe and hit the notification bell.